The head of the St. Louis Metropolitan Pandemic Task Force, Dr. Alex Garza, is also the Chief Medical Officer for SSM Health. He joins us now live. Dr. Garza, let's first talk about the holiday weekend. We know despite many medical professionals talking about people being away from their families this Thanksgiving, not being in those weekend Thanksgiving pods, in addition to long lines at bars in St. Louis County without masks and social distancing. So our question for you this afternoon is, what is your expectation for as far as the holidays and the virus's spread in the region in the next week?
Yeah, so we know that there's going to be an increase in cases just from just what you mentioned, from people getting together, you know, maybe not wearing masks or social distancing. So I think really the question is how much are we going to see? And that's really what we don't know right now. So we believe that there will be a bump from the holiday season, but it just depends on how much there is right now. And so when you start thinking about that, in addition to sort of the patient load that we have right now, that's when it becomes really concerning, because we're setting records every day on the number of COVID patients that we're taking care of.
And talking about setting records, our hospitalizations continue to rise. Another new record with that today. Based on the current trends, when will we run out of bed space to treat people and to treat everyone that comes into the hospitals?
Yeah, so it's always a challenging question to answer. So if we continue on the current slope, so the number of cases that we're seeing right now and the number of hospitalizations that we're seeing right now, we'll do things internally to create more capacity, such as shutting down some of our other services and increasing our nurse to patient ratios, things like that. But again, it's still a finite resource. So we're thinking somewhere around mid December could be a time frame where we may run out of either critical care capacity or total capacity, just depending upon how many patients we're going to continue to see.
Running up against crunch time at this point. We know a
Yeah.
lot of patients are coming out of rural areas in our hospitals. So what is the makeup of the hospital population right now? We know it's affecting younger patients, older patients. So are they younger or older in the hospital, and rural or urban patients that are in these beds right now?
Yeah, so when you look at it on like a pure volume basis, of course, more of the patients are coming from the more metropolitan areas, but that's just because our population is more. If you look at it on a per capita basis, we're seeing sort of that equal distribution between the metropolitan areas and the more rural areas. So we're getting a significant volume from transferring in from those rural areas, and on a per population basis, it's nearly the same as in the metropolitan areas. So still seeing patients coming in from all over that are filling up our hospital beds.
And we appear to be on schedule. I want to talk about the vaccine now for
Sure.
distribution of a vaccine here in the next 2 weeks. As the head of the task force, Dr. Garza, you're our expert on these plans and how they're coming along. So when will we see the first vaccines in St. Louis? Who's going to get them? And then how long before the next round of it, and for who?
Yeah, so there's a couple of steps that need to occur. So one, of course, is the FDA has to issue their emergency use authorization. Then the CDC will come out with their tiering from their immunization panel. We'll say this is who we believe needs to come, or who needs to get vaccinated first. According to the state's plan, it's broken out into a couple of different tiers. The first tier would be the healthcare workers, and then people that are at high risk for disease, and first responders. So we will get a certain allocation here in the state of Missouri, and then down to the metropolitan areas. Most of that will be reserved for those healthcare workers to get immunized. And so, just to put that into a little bit of perspective, though, it's still a 2-dose regimen, and that's separated by 3 weeks. And so, whatever allotment you get, you have to divide it by 2 because it's a 2-dose shot. And so, still a significant amount of logistics that are going to have to be involved with getting people immunized.
Okay, I just had some questions walked into me about the vaccine that I want to get to with you real quick while we
Sure.
have
Mhm.
you. What do you foresee as the state's biggest challenge in distributing the vaccine?
Yeah, so there's a couple of things. So as I mentioned, there's the 2-shot regimen, so that's going to complicate in delivering the vaccine. As far as shipping vaccine, things like that, we do have the ultra cold refrigeration that for the Pfizer vaccine. So I don't think that is going to be a significant issue. It's really the logistics around how do you get everybody together so that you can deliver the vaccine, and then make sure they're coming back for that second dose. Now, once the Moderna vaccine comes online, that doesn't require the ultra cold refrigeration. If they get an EUA at the same time period, then that ultra cold refrigeration isn't as big of an issue. And so then you're able to distribute more widely. But for the Pfizer vaccine, it's going to be concentrated more in some of those more metropolitan areas just because of that requirement.
And my last question to you this afternoon will be about what you just mentioned about making sure that people are coming back for that second portion of the vaccine.
Yeah.
Vaccines really only work if most everybody gets them. So how do you address the skeptics with a vaccine and making sure that they're not only coming back for that second dose, but getting in line for the first one too?
Yeah, that's going to be, it's going to be a challenge, particularly in this year and with the development of the vaccine, which the government and the researchers have all put together in a very short period of time, and then talking about the safety profile and the efficacy profile, and so there's going to be a large amount of work that's going to have to go on with messaging about the safety and how effective of a vaccine it's going to be. Particularly in populations that are traditionally skeptical of medical care, and for some for good reason from past issues when dealing with medical care. So in addition to sort of that scientific piece, there's also going to have to be the communications piece in order to make sure people have uptake of the vaccine.
And hopefully that's a conversation that we're having more seriously in the next couple of weeks in the sense of having a vaccine by then. Dr. Garza, appreciate you as always taking the time with us this afternoon.